a single specialty orthopedic setup in a small town called Alibag. I'm incidentally also attached to Apollo Belapur, a corporate multi-specialty hospital. There are certain advantages of practicing orthopedics in a multi-specialty hospital, but I am most comfortable to treat all my patients, most of my patients in my small setup that is in my own town. And the biggest plus of my setup is my staff. They're the backbones of my practice, and here I am going to share with you some of my thoughts about how to overcome and the difficulties in getting staff and difficulties in making them work for you the way you like when you start a small nursing home in the periphery. Staff recruitment as training doesn't sound very glamorous, so we call it human resources management. Most of my talk applies to a single specialty orthopedic practice in a small rural area setup, but some of the talk will apply to all setups in a single specialty orthopedic practice. What is rural, what is urban? There is no clear definition. Even the Clinical Establishment Act divides hospitals into 4 categories: rural, urban, metro, and notified inaccessible areas, but still, it doesn't define all those areas. So in short, when we come to rural-urban divide, we feel that for an orthopedic surgeon, we have to combine our advanced orthopedic surgical knowledge with locally available manpower and resources to give appropriate care for the rural population. Nobody wants to settle in rural areas because of lack of infrastructure, lack of recreational opportunities, lack of growth opportunities. But there are certain plus points of the rural areas which you can sell. Your vacancies you can sell by telling them the positives of the rural areas, like there is less crowding, there is more time, there is less commuting time to your workplace, more time and space for yourself and your family, there's pollution-free air to breathe, less overhead expenses. Some of your trained staff may be interested in going back to their roots, and I really doubt whether serving rural population is a selling point for the rural practice. Recruitment strategy. In an urban setup, you have to have, most of them will have all those categories of staff, like RMO, staff nurses, technicians, receptionists. Whereas in rural, and it is usually done, the recruitment is usually done through a dedicated HR manager. In rural ortho setup, the onus lies on you. You are the one who will be recruiting everybody. So the sort of recruitment advertisements are a little simple. In urban setups, they are flashed in newspapers or websites, but in rural setups, this is one of my friends in Alibag who just posts it on the side of his OPD door. Recruitment, when I recruit a new person, what I see is they may not have any formal education, but it's the readiness to learn new things that's most important, and their multitasking ability. See, we have limited resources, and we have to manage our all staff in those resources. So our staff should be able to assist in surgery, clean the ward, X-ray, driving. They should have basic computer skills. So here is one of my staff. He is there with me since last 18 years. He's doing the X-ray. He's doing the computer X-rays. He's doubling up as a receptionist. He's assisting a physiotherapist, and also he's assisting in my OT. Now, for the multitasker, I call them multitaskers. They should be physically fit, preferably male, because you have to have a lot of heavy duty work going on in your orthopedic practice. It's preferable to recruit a local talent. They should have some formal education, should be able to read and write, and should have some working knowledge of English. They should be honest and loyal. Usually, they should be coming through a good reference. Very rarely, I have advertised and taken interviews. And you should have some inclusive strategy. Try to include all the social stratas in the local society as your staff. Immediately pre-recruitment, we should have some background check. Usually it is informal, but sometimes you may need to do a police verification. Then credentialization. Try to check the certificates and reference letters which the prospective employer has produced to you. Get the copies of some identification documents and some blood tests. Post-recruitment. This is the time when your real work starts. You need to train them. Initial staff, you have to train them. This training starts with very basic things like hand washing, autoclaving, sterile OR techniques, washing instruments, taking IV lines. And mind you, some of the things like autoclaving, washing instruments, they are not taught when we do our post-graduation or when we do MBBS. So you need to know how to do all this stuff. You need to send them to your friends for additional skill training when you install new equipment. Like I installed a CR in Alibag in year 2006. That was the first CR in Raigad district. So I sent my staff to Chembur in one of my radiologist friend. He stayed there for 7 days, trained and came back. Some formal training to handle instruments is a plus, like AO courses for operating room personnel. I find them very good. I also go there as a national faculty, and it gives you a different insight into the minds of your staff. I mean, if you happen to have a chance to go for the faculty as operating room personnel, try to go there. Then you can take them with you when you go for a fellowship to learn a new technique. I went to Sancheti sir in 2008 as an Indus knee fellow. And I asked sir, can I take my staff with you so that he can learn what is required for a total knee replacement as an assistant? And he agreed immediately, and I took my staff with me. So these are small things. So although they don't have a formal training in all those things, you can make efforts to train them. Pick up those with a flair for teaching and ask them to train others, so that decreases your burden. You can start a small institute in association with your doctors in the area so that you get a trained manpower. Then remember, you will be your only surgeon running the show. So in your absence, they should know which patients to accept, which patients to refer. You don't want to lose patients. At the same time, you don't want to keep complicated patients, especially in your absence. So they should know all this. Getting the work done, again, it's a different ballgame. You can find all those things in all literature, but most important things, nobody should think that he or she is indispensable, so try to train one extra person to do that particular job. Then retention strategies, know the market rate, pay them more than that, bond beyond work, do loyalty additions, and offer them growth opportunities.
Dr.
So there are
Sathaye,
some, So take-home message will be, So take-home message will be, try to know the advantages of rural, then recruit multitaskers, train them to suit your needs, retain them by various strategies, know some government norms, and as you grow, try to fulfill them. Thank you.